Cardiac arrest is a life-threatening disease in that if nothing is done in a few minutes, it can lead to loss of life. These diseases most time occur without signs or symptoms, even as humans interchange cardiac arrest for health attack. Pharmacist Nelson Emmanuel, while explaining the differences between cardiac arrest and heart attack, said cardiopulmonary resuscitation is paramount in cardiac arrest.
You know, the word cardiac arrest and heart attack are used interchangeably, and at times people think they're the same. They are not. In cardiac arrest, the heart stops beating. The person is unconscious. The person is unresponsive. Most times, the person does not have a pulse, so the heart is not beating. But in heart attack, it happens because an artery that supplies blood to the heart is blocked. When that artery is blocked, blood supply to the heart is stopped. And when that happens, the part of the heart muscles, they begin to die. And most times, heart attack comes with a pain, a kind of pain. Maybe you see the person holding the chest. Cardiopulmonary resuscitation. That particular thing you are doing might not wake the person up, but it might give that person enough time so that the person can come back to life. If the brain lacks oxygen for a few minutes, the person can become brain dead. Person can get into a vegetative state, what they call coma. So from coma to death, that compression you are doing is what the heart is supposed to be doing. So that compression is to keep the blood flowing to the brain and other organs so that the person does not go into coma.
Most cardiac arrests in adults are caused by coronary artery disease and heart attacks, while in children and young athletes, it is often due to congenital heart problems or structural electrical abnormalities.
Heart attack actually causes cardiac arrest, but not all the time. Cardiac arrest can also be caused by electric shock. It can also be caused by major blood loss. Like, for example, somebody loses a large volume of blood, the person can go into cardiac arrest. It can also be caused by drug abuse. For example, people who abuse hard drugs such as cocaine, stimulants. But the major cause of cardiac arrest is an abnormal heart rhythm that is called cardiac arrhythmia. The heart muscles, they work in unison to pump. The heart is basically divided into two, the atrium and the ventricles. Now the ventricles are the ones that, they do the pumping, they squeeze the blood, they pump, it gets to all parts of the body.
Pharmacist Emmanuel is sure that age is a risk factor to cardiac arrest, as age 30 below is not at risk.
Age is a risk factor for cardiac arrest. It rarely affects people aged 30 and under. But from 30 and above, there are chances. So as the age increases, the likelihood of having a cardiac arrest increases, because by then, some people are already suffering from other diseases like maybe diabetes mellitus. Some people already have hypertension. And then, with age, functionality of the heart reduces.
Preventing cardiac arrest largely means reducing the risk factors that can trigger sudden heart stoppage. While not all cases can be prevented, many steps greatly lower the risk.
Sedentary lifestyle is a serious problem. Now, when people do not exercise, your body is not meant, blood is supposed to be flowing. So when you sit, these things don't happen overnight. When you walk for long, you sit for long, your blood flow is slow. Sedentary lifestyle can lead to heart diseases that can lead to cardiac arrest. So it's intertwined. Exercise is the best treatment God has given to anybody. And it's free, just for you to move your body. So for those who do not exercise, it is a risk factor for cardiac arrest. Proper checkup. People should do proper checkup. Check your lipid levels. Avoid alcohol. Avoid caffeinated drinks. Avoid doing hard drugs. Exercise. We do not have a lot of people trained in CPR. I think the government needs to come in. People need to know CPR. Cardiopulmonary resuscitation. So that you can save a life. Churches, government, organizations need to invest in teaching people CPR. If government invests in health, in such as having a hotline that people can call, why calling the person? The person must know how to do CPR. Time is of the essence. It is very important that cardiopulmonary resuscitation is done on time. Because these days, most times you see when things are happening, instead of people trying to help, they are bringing out their mobile phones and doing video. That time you used to do video, use it to save a life. I believe if these things are managed properly on time, death could be averted. It is a vital thing that everybody needs to know.
Carving out time for exercise and regular checkup, as explained by pharmacist Nelson Emmanuel, can greatly reduce cardiac arrest. Jonathan Lirama for Lina TV.